I'm here today with Tim Brack, and we are talking about Medtronic, a very important company right here in North Florida. Tim, welcome.
Thank you. Yeah.
Tell us about Medtronic. What does it do?
Yeah, Medtronic is a worldwide medical device manufacturer, and we're all over of course, the world. The company itself, our operational headquarters is in Minneapolis, and we started out as a pacemaker company. And what a lot of folks don't know here in Jacksonville is that our ENT division, ear, nose, and throat division, is based here in Jacksonville on the south side.
Wow.
Yep.
So do you get a lot of referrals then from other parts of the country, or is this, as the point of specialty?
Yeah, so for ear, nose, and throat physicians all over the world, we actually manufacture, develop, and produce and market and sell products out of our Jacksonville facility all over the country and then also all over the world.
Okay, and you brought along with you a little bit of a promotional video. We'd like to show that now and give people at home an idea of what you do.
Absolutely.
Are you one of the 31 million Americans who suffer from sinusitis? Symptoms of chronic sinusitis can have a severe impact on your quality of life. These symptoms may include headaches, facial fullness, pain and pressure, difficulty breathing through the nose, nasal discharge that isn't clear, fever, fatigue, and upper tooth pain. Many symptoms of chronic sinusitis are caused by improper drainage of your sinus passageways. These passageways may be too small or blocked, which can lead to infection. Your doctor may prescribe medications to treat your chronic sinusitis. If your symptoms have not improved with medications, your doctor may recommend balloon sinus surgery to treat your chronic sinusitis. Nuvent EM Sinus Dilation System is used in a minimally invasive surgical procedure to open blocked or narrowed sinus passageways. It's often performed right in your doctor's office under local anesthesia. The Nuvent system is unique because it uses image guidance technology that displays a visual map of your sinuses, much like a GPS on your phone or in your car. Your sinus anatomy is unique to you. Your doctor uses Nuvent with the IGS to find the blocked sinuses and place a small balloon. Here's how it works. Your doctor will insert a small balloon into the sinus pathway using the image guidance system to confirm precise placement. The balloon is inflated for only 5 seconds, deflated, and the process is repeated as necessary. By using image guidance technology, the doctor is able to see your unique sinus anatomy and accurately guide the balloon to help you where you need it most. Balloon dilation does have risks, including trauma, bleeding, infection, and possible ophthalmic injury. Patients should always discuss the potential risks and benefits of any treatment or procedure with their doctor. If other treatments haven't worked for you, talk to your doctor to see if Nuvent is an option for you.
That's interesting. A lot of people may not even realize that that kind of procedures are even available.
Exactly, exactly. So a lot of folks that have sinusitis, as they said in the video, there's 31 million Americans that suffer with this now. The challenge that they run into is that they think that the only course of action is whether antibiotics or jumping into full-blown surgery. A lot of technology, like what we have from Medtronic with the Nuvent balloon as well as others, provides the kind of an entry point in between, which could be a minimally invasive procedure that a lot of ENT professionals are doing in their office now.
Wow.
And when they go to check with an ENT professional, they can, of course, give them the best course of action for what's going on with them specifically, and this balloon procedure could be one of those things to help out.
So essentially then the balloon procedure is able to go up through the sinus and maybe expand and then open up the openings that were previously closed?
Yep.
Not open at all?
So if somebody has sinus pressure or pain, there's a lot of folks out there that suffer with that, and they think it's just headaches or other things, and that sometimes may not be true. Whenever the sinuses become inflamed, they can close off those osteo, which allow the mucus to drain out of them. And if those get closed off, then pressure builds up and more inflammation occurs.
And oftentimes, my understanding is if there's a lot of buildup and it's impacted like that, that's also a breeding ground for bacteria.
Exactly. Yep.
So then you're on antibiotics on top of everything else while you're dealing with this situation.
Yep.
How long does a procedure take from start to finish if someone were to opt to have it done?
Yeah, so a lot of times, like I said, they're doing this in the physician's office. It can be anywhere from, a 45-minute procedure based on start to stop time. The patient will come in and go through just a quick anesthesia protocol, which will be up to the physician on what that looks like, and then the patient will have the actual procedure done.
Okay, and what are the age ranges for this?
Our balloon itself is indicated for 18 and up. So it's what we would say adults and up. We don't have a pediatric indication as of yet, but the vast majority of folks that are suffering with this are, of course, in that age range.
Right. Seems like a lot of kids you hear about with asthma and things like that, and may turn out to be something like this down the line.
Right.
Okay.
Absolutely.
What are some of the questions you get from parents that are asking, or spouses, when they have a loved one?
A lot of times it's folks just seeing if there's a way to cure the symptoms that they're having. And if antibiotics aren't doing it or self-medication isn't doing it, they can get into a cycle where they unfortunately don't feel like there's any kind of treatment options. And then, you know, up until now, there's been treatment options, but it could be full-blown surgery where you go into the OR and have to go under general anesthesia, which can scare a lot of people. So what they're doing now, like we said, is moving towards more of a minimally invasive approach where they can go into the ENT's office, have some local anesthetic, and then they'll go in and do this while the patient is awake and actually talking with the physician. And
it must be minimally invasive. And I want to show some close-ups of some of the items that you brought in here today.
Absolutely.
And you can tell us what we're looking at. Now, what is this?
Yep, this is the actual Nuvent balloon. There's one balloon, and we'll show a set of them on the next slide, which actually shows all 4 types. The 2 on the left are for the frontal sinus. The shorter one that's in the middle there is for the maxillary. And then we also have what's called a sphenoid sinus in the back, which is what the longer one on the right side there is for.
So how many sinuses do we have? Are they just 2 sinuses and with different angles coming at them? When I saw that,
basically four sinuses. So frontal, maxillary, sphenoid, and then you've got ethmoids in the middle.
Okay, and which one primarily gets clogged that is a candidate for this?
The vast one that a lot of folks say they have frontal head pain or pain in their head in the front is going to be the frontal sinus.
So then in that case, you would take one of these devices and go up through the nasal cavity?
Absolutely, and it'd be this here up through the nasal cavity. And what's nice and different about our balloon is it uses image guidance. We have a picture of our image guidance system here as well. This is our Fusion Compact. This system allows a physician to basically do a 3D image of everybody's anatomy. What's crazy about the sinuses is everybody's different. Mine are different than yours, which are different than everybody else's. And that device allows folks to track exactly where this instrumentation is at all times. So it's a very safe procedure. So they know where they're going and they know that they're in the right spot before they dilate and basically move back the mucosa and break the bones that are there. That's
amazing what they can do with technology. We only have a few seconds left, but tell people at home where they should go or what they should do if they're interested in this Medtronics procedure.
Absolutely. So if you're interested in learning more, go to sinusitissurgery.com. And there you can look for there's a physician finder. There's also a brief self-assessment. Here's a picture of what it looks like. And what's nice as well is if you look at the top left, there's a Find a Doctor component. If you click on that, you can put in your zip code, and it'll pop up a physician in the Jacksonville area that can certainly help you out.
Excellent. Tim Brack, Medtronics. Future together, I believe it. Thank you so much.
Thank you.
Great coming in.
Appreciate it.